The National Mental Health Survey of India has shown that roughly about 2 to 5% of India's adult population is living with a depressive condition. But what is even more staggering is the fact that more than 90% of those individuals have received no care at all.
In rural India, the frontline health force, such as Ashas and Anganwadi workers, are responsible to make sure that mother and children lead a physically healthy life. But in this particular village of Madhya Pradesh, the health services delivered by the Asha workers are a notch higher because they have been trained to look for any signs of mental illness as well. More often than not, maternal depression leads to malnutrition and poor early child development. These are major contributors to disease burden among women and children. Sangath, one of the leading community-based health research non-governmental organizations, who are committed to work towards the treatment gap in the area of early child development and mental health, where the frontline health workers would be trained to identify and treat perinatal depression through an evidence-based psychological intervention, along with a video-based parenting intervention to promote early child development.
Sangath was founded in 1996 in Goa as a community-based child development center catering to the needs of children with emotional, developmental and behavioral problems. Sangath is a global pioneer in leveraging community resources to deliver psychosocial interventions. Women who live in rural parts of the country are even more disadvantaged for three important reasons. First of all, patriarchy. The second is that mental health services are almost completely absent in rural India. And the third is the stigma attached to mental health problems, particularly around childbirth, is much greater. Even the idea that you can be depressed is almost a shameful thing to acknowledge. What we're doing with HCL, we hope, is to integrate two evidence-based interventions, one targeting depression in mothers and the second targeting early life child development, into one program and delivering this through the public system. To me, this is the most innovative approach to scaling up mental health care in India.